Welcome everybody to our cow-calf workshop. Our presenters this evening are Amanda Kaufman, who is the regional livestock educator from the southwest part of Wisconsin, and Ryan Steary from the regional dairy educator from the northwest corner. So we're from the southwest and the northwest. And then me, I'm Sandy Stuttgen, the agriculture educator from Taylor County. Sandy Stuttgen, I'm the ag educator here in Taylor County. I joined Extension from an 18-year career as a practicing dairy veterinarian. And for the purposes of our presentation tonight, I want to define successful calving as a pregnant heifer that delivers a live calf. She mothers it and she raises it. And success is further defined as that first calf heifer that then breeds back and delivers a calf year after year, because Amanda said it. She needs to do that 5 times to pay for herself. The points in my presentation address including managing that pregnant heifer so that she now reaches 85% of her mature weight right as she calves, and that she's at a body condition score of 6 before delivering her calf, and into and holds that after calving. That she calves in a clean environment, and we're going to discuss the calving and calf management needed to get that calf going. And lastly, we're going to touch upon some management tips for helping that heifer to now breed back with the upcoming breeding season of the herd. Now, we set the stage for successful calving by meeting her nutritional needs at breeding and helping her to create fetal protection at conception. And from the previous presentation, we have successfully bred this 826-pound heifer. She's conceived, she's 14 months old. We confirm she's pregnant, and now we need to grow her to her calving date. So we've got basically 283 days to go, which is a typical gestation rate, and there is a typo on this slide. This 826 pounds times 85%, she needs to weigh 1,190 pounds to meet 85% of that 1,400-pound mature weight. But she's growing a calf, so we got to add some weight for the calf and the fetal contents, the fluid in her uterus. So we're going to add 100 pounds to that. So shortly before she calves, she needs to weigh 1,290 pounds. So we can do the math on this slide, divide that by our days of 283. We've got 1.64 as our target average daily gain. So I want you to go home and dig out your scale and weigh your heifers and do your own math with your own due dates and work with your nutritionist to balance a ration using your own forages and feedstuffs to provide that gain that you need. So these are some of the bullet points for how to help that heifer get all the nutrients that she needs. We need to, Ryan said this earlier, do lab tests on our forage so we can do some ration balancing, that we know exactly what our forage is providing. Working with a nutritionist. You may have to feed these heifers separately from the mature cows so that they're not bullied and pushed away from the bunk. They have to have adequate bunk space. If you're managing a pasture, then manage it. You want to do a little bit of rotational grazing so that these heifers are eating growing grass. And these animals are immature, so they're going to respond most to your deworming dollars. So talk with the vet on how to deworm these animals if they're on pasture, and use the correct products in a timely fashion. Choosing the calving season itself that's most compatible with your forage program is one way to maximize your first calf heifer condition and her reproduction. Now, in the January 2022 issue of Progressive Cattlemen, there was an article there from Jordan Thomas from Missouri State Cow-Calf Specialist, and he said that by choosing to calve in alignment with the timing of good forage growing conditions, we also happen to then calve when calf survival will be at its highest. And remember that pregnant heifer and those fresh heifers, they're still growing. They need good quality protein from those in-season forages to grow that fetus and to make the immune factors that are passed into colostrum. So we do want the pregnant heifers to calve before the adult herd. because growing heifers need more post-calving days to recover their reproductive and potentially their body condition prior to the next breeding season with the rest of the herd. And as they freshen, and oh, by the way, I keep using that slang term, freshening, that means calving. Seems to me that freshening is a dairy term and calving is a beef term. So as they calve, they're going to join the adult herd, and then all the calves, the first calf heifers and those born to the older cows, are all going to be put together and then weaned together. So calves born early in the calving season have more days nursing and a longer time to learn how to eat forage and to grow their rumen, and potentially they'll maybe be able to catch up in weight from their typically lower birth weight to at least be close to the average for the calf herd weaning weight. Calving ahead allows the newborn access to the cleanest environment and ideally the fresh, excited herd manager who's up for his first calving season of the year, right? And remember, these heifers, you have no prior calving history with them. You don't really know what's going to happen. So they have to be watched for dystocia. And the term dystocia means difficult labor. Now, mature cows will increase the risk of diseases to neonates. You really don't need multiple helpful mothers drooling all their germs all over that newborn. You also don't need mature mothers trying to steal the calf or confuse the heifer. So it can be very helpful to not only calve them ahead, but to separate them from the adults as they're calving. Pasture or maternity pens can be used during the calving season. If you're using outside areas, they need to provide good drainage and some slope to it and some protection from the wind. When you're using a dry lap scenario outside, then the general rule of thumb is to provide 500 to 800 square foot per cow calf pair. If you've got really well-drained soils, you can probably cheat that down to 250 to 300 square feet per calving pair. And then if you're going to move under the roof into a pen with no access to a dry lot, then you need to maintain about 120 square feet. You get it too small, it's just going to get too wet and it's going to be too difficult to keep clean. Now, several research studies have concluded that mothering, dam calf bonding, and colostrum intake actually went down as the calving area decreased from pasture to calving pen. So you read that and you think, oh, so they should all calve on pasture. But the flip side story of that is this is often due to the fact that heifers are unaccustomed to the pen. While she will naturally seek isolation during calving, she's going to get pretty agitated if you chase her in and abruptly throw her in a pen and separate her from the rest of the herd. You need to take time to acclimate her to that area, maybe feed her by it, let her walk through it, or when she's penned in it, she can still see her buddies. Several times during my literature search as I got ready for tonight, I read the statistic, 80% of calves lost at birth, who died at birth, are normal. And these calves likely died due to delayed calving. So it's harder to identify animals in calving distress when they're out on pasture and when it's not convenient to restrain and examine them there. So it can be very helpful to pull it into a calving pen. But by definition, one maternity pen equals one calving animal. You want to move them into this pen when you see the water bag or the feet protruding. You do not want to house closed-up cattle in these pens, as again, sanitation becomes a problem. USDA Veterinary Services research concluded that calves born in confinement had a 2-point increase in their odds of getting sick when born in a pen over those not born in a pen. And again, that's because the calving pen was not kept clean enough. Now on this slide are all the steps that the Wisconsin Veterinary Diagnostic Lab recommends as their salmonella cleaning protocol for cleaning and disinfecting maternity pens between each calving. Salmonella is a huge issue, especially in the dairy world. And what I want to point out here is don't be blasting everything with a high pressure washer and calling it good, because all that does is aerosolize all the germs and puts it all into the air and spreads it all over your calving area. If you're going to scrub it correctly, you need to do that with a stepwise process of using acidic and basic disinfectants and cool and hot water in order to correctly kill the invisible pathogens that live on the surface and the walls of the calving pen. Now, this cleaning protocol adds additional labor, I get it. And some of you don't have the ability to be spreading water around in the winter, and some of you don't have a concrete floor, you're using dirt. But whatever you do, you need to clean as much as you can between every calving, take out as much of all the wet that you can, and then rebed back with clean, deep bedding so you get a nice deep barrier between the calf and the floor. For optimal reproductive performance during the subsequent breeding season, the first calf heifer has to have a body condition score of 6 at and after calving. So evaluate her monthly and adjust your management accordingly. You may have to feed to the outliers or separate as you go or add supplements as needed. Underfeeding prior to calving will increase the calf scour and death of those calves. Overconditioning heifers deposits fat in their birth canal, and that leads to calving difficulty. Early on, that fetus is growing its internal organs. Later on, during the last trimester, that's when it's really putting on skeletal size and muscle. So we don't want to make compensatory weight gains during that 3rd trimester, because if you do that, you're going to increase the likelihood of calving difficulty. Now, it's critical to manage body condition score in the winter when that 3rd trimester of pregnancy is occurring in our spring calving herds. As her pregnancy advances, her requirements for net energy and improved protein are going up as well, because she needs to support herself and that fetus and the placenta. Cold wind, wind chill, wet wind, all of that adds to her nutritional requirements. And if we don't meet her nutritional requirements, she's going to start to lose condition. Following calving, her nutritional needs again increase to support that lactation, and her body will continue to prioritize nutrient needs for gestation and lactation over her own growth and over her own reproduction. It's going to be really difficult to adjust that ration and have her increased body condition in time to cycle with the rest of the herd. This Purdue University data clearly demonstrates how thin cows take longer to exhibit estrus following calving, and that results in an extended calving interval and a failure to achieve 1 calf every 12 months. On this chart, only 2/3 of the cattle with the body condition score of less than or equal to 4 at calving resumed normal estrus by 90 days post-calving. If the interval from calving until normal estrus cycles is extended past 85 days, then that will extend your calving interval as well. Now, this research does show a small number of cows, there's 50 of them here, who had a body condition score of greater than 7, which we would consider to be over-conditioned at calving. And they almost sort of look like they did okay, because like 100% of them were showing estrus by 90 days post-calving. However, the risk of calving difficulty increases with those over-conditioned animals. And we can see that on this slide. This is from Louisiana State University, and it shows that thin heifers had the highest calving difficulty. They needed the most assistance, and that rate increased with the fat heifers. 5 and 6 is the sweet spot for body condition score. Too small increases the likelihood of the calf being too big for her pelvic opening. Too thin indicates she does not have that nutritional reserve to endure that calving process and then cope with that tremendous switch over in her body from non-lactating to lactating, which comes with that switch of energy partitioning and how she uses minerals and vitamins, all the while she's still trying to grow. Calf performance suffers when calves are born to heifers that have inadequate body condition score. Oftentimes these calves are smaller and they're weaker at birth. The heifer herself may produce inadequate colostrum volume, and that increases the risk for failure of passive transfer of immunity. She may also produce less milk during her lactation. Thin cows that get pregnant following an extended postpartum interval will have calves that are younger and smaller at weaning the following year. The cycle just keeps repeating itself. Now, in Wisconsin, with our abundance of good quality forage and corn silage, our problem is often not heifers that are too thin, but rather those that are too fat. Overconditioning can lead to dystocia. We saw that in the previous slide as the percent of assisted calving increased as that body condition score went to 7. Now, I've personally ripped fat from the pelvic inlet while jacking up calves out of fat heifers, and those fat heifers have a potential to fall apart after calving, especially after a difficult calving. If they're sore or develop a fever, they're going to go off feed, and then they're going to start to mobilize their own fat stores, and they got plenty of fat to mobilize. So they'll flood their liver, and that makes their liver struggle. And you can actually get these cows into some of the same problems that we see with dairy cows and fatty liver disease and even ketosis. And if it's not to that degree, that off-feed cycle is going to continue, and that's going to lead to estrus delays, and again, increase your calving interval. The one source I read for preparing to talk with you tonight said that 40% of heifers will experience dystocia, compared to 20% of mature cows who do. Close-up cattle, therefore, including those heifers, need to be watched 3 times a day, and that means morning, afternoon, and during the night. The use of cameras, including those that sync to your smartphones, have been shown to be really helpful in monitoring calvings, and those that use them say they pay for themselves pretty quickly. You can encourage daytime calving by feeding twice a day, those close-up animals. You feed them at 11:30 in the morning and then at 9:30 at night, and that will actually encourage close to 80% of them to calve during the daytime hours the next day. This was work that was done by Canada researchers. Now, the USDA research repeated that study, and they didn't get such a phenomenal result, but they did find that there was a 20% reduction in the number of nighttime calvings. Having close-up heifers in an area with easy access to that calving pen that has good footing, light, access to hot water, and a chute is going to make your calving season easier. You want the chute with the head gate set so that you can get on both sides of it. Most C-sections are done from the left, but there are times when you might want to or have to do them from the right. So I, as a veterinarian, want to be able to get on both sides. You also want both sides of that chute to be able to be opened, not only for surgery, but in case she goes down. And think about that as you set up your calving areas. Also, can you get a skid steer in? Can you lift an animal in that area? Don't be sticking these maternity pens in the back corner, really dark, hard to get to. It just sets you up for some miserable situations. Calving heifers should deliver within 1 hour of the water bag showing. And you can feel pretty uneasy watching a laboring cow when you don't know how long she's been at it, but don't rush the process. After watching for 20 or 30 minutes without obvious progress, then restrain her and conduct a clean vaginal exam to assess the presentation. Now, an anterior presentation or a posterior one could be delivered by pulling from her if her cervix is dilated. So an anterior presentation is one where 2 front feet and the head of the same calf are presenting, and posterior is 2 rear feet and the tail of the same calf. If that's there, either one of those are there, and her cervix is open, you can go ahead and assist with that pulling. But if her cervix isn't ready, then back off and give her a little bit of time, or even if you have to correct it and you've got all the correct parts lined up, you might want to back up and let her just see if she can make some progress. The adage is do no harm. Don't make it worse than what it was with your intervention. So during difficult calvings, the calf may become low in oxygen, which leads to a condition called acidosis, which contributes to their ability to regulate their respiratory rate and their ability to regulate their body temperature, and it contributes to their overall depression. So following a dystocia, you really want to work to stimulate the calf to get it breathing. And these are some of the bullets we think about for stimulating that calf. You can tickle its nostril with something stiff, like a strong, sturdy piece of straw, or your pen cap. You're trying to get that calf to sneeze, because if it sneezes, it'll take a breath. Cold water in the ear, put the calf up on its chest. You can frog leg it by pulling its back legs back so it'll sit up. We're not about hanging calves, tipping them upside down, because it looks good to us. You see all that fluid come out of their mouth and their nose, and you're thinking you're doing a good thing, but how many of you can stand on your head and breathe at the same time? And that's what you're doing to that calf when you lift him upside down. You're putting all of his abdominal contents on its diaphragm, and it can't breathe. So don't hang them, set them up sternal, vigorously towel dry them. Dr. McGurk in her work at Madison talked about giving calves oral caffeine, 100 to 200 milligrams. You pull some of this out of those little high energy drinks you can buy at the gas station, put that in their mouth, and it'll start to stimulate him. It takes about 15 to 20 minutes. Read the label on their products. I was standing in the checkout at Family Dollar the other day, and it was a little generic sucker, and that bottle had 2 grams in it, which is 10 times what the calf needs. Okay, so part of it goes to the calf, and you drink the rest, and you're good. The other thing to remember is that navel on the calf is attached to their liver. It will wick environmental pathogens right up into its liver, everything that gets drained through the mud with that navel. So we really want to make sure that we disinfect that navel with an appropriate disinfectant, such as 7% iodine. Do everything you can to encourage that heifer to feel better. Don't let her lay. There could be some nerve damage. The longer she's down, she needs to get back up on her feet and get blood flowing again. Talk with your vet about some pain medications you can give to her, including aspirin or meloxicam. And I'm talking about the large boluses of cow aspirin, not their bottle from your own medicine cabinet. There's been some new work now in the dairy world where they are routinely giving aspirin to fresh cows to make them feel better so they keep on eating. You also can think about offering warm water for her to drink in shallow buckets. I found that cows and heifers don't like to put their head down in a deep, narrow bucket. So that means you get to carry lots of short calf buckets to them. And make that warm water, they seem like warm better than cold. And you can make it smell better by putting some milk replacer in it, or even some electrolytes to get her to drink. Now, if she continues to be depressed and won't drink, you might have to think about calling a vet to have him or her come out. They can IV hypertonic saline to make her drink, or maybe stomach pump her. Do what you can to make that calf interesting so that she will mother it. You can do this by salting the calf or dumping sweet feed with lots of molasses over it. There's also some over-the-counter products. Per label, they claim there's something called Orphan No More. It's supposed to work by masking the odor of the calf with a more intense odor than the cow desires. People say it works. Time is critical. We want that calf up and suckling within 2 to 3 hours of being born. There's also over-the-counter gels and pellets you can give to help calm that heifer. And you can also talk to your vet about having some injectable acetylmazine on hand or other tranquilizers that you can use to sedate her if she's crazy and won't let the calf near her. These agents are used for standing sedation. We don't want to make her so dozy that she lays back down. Go ahead with your record keeping and record the calving difficulty on both the heifer and the calf's health history. You can use a 1 or a 3 or a 4-point scale, 3 or 4, not 1. No pull, easy pull, hard pull, or C-section, whatever you need so you remember. Also go ahead and note the calving outcome and the calf's vigor score, live calf, sort of live calf, dead calf. Anything it takes so you remember how it happened and record her mothering attitude. Have your veterinarian conduct a 30-day post-calving uterine exam of anything that you delivered or you thought had a hard calving. Go ahead and take temperatures of heifers when they are not eating, and with veterinary advice, administer antibiotics only if they run a fever over 103. There's other reasons she might be not eating. It's not all about reaching for the tetracycline adrenaline. The placenta should be expelled within 8 hours after the calf's delivery. By definition, a retained placenta is one that's not passed after 12 hours. If retained, do not forcibly remove it. Let it hang there, because while it's passing through the cervix, it'll keep the cervix open, and that's a good thing. With under aerobic conditions, with lots of air, her body will break that placenta down, and she will pass it in 4 to 7 days. A uterine infection, which is called a pyometra, may result if pieces of that fetal membrane become trapped behind a closed cervix. Injectable antibiotics are warranted for treating a retained placenta, again, if she runs a fever. Antibiotics and other supplements placed in the uterus are generally ineffective. Actually, they do more harm than they do good. They can also lead to violated drug residues in milk. So some producers make the decision to not breed that heifers that had calving difficulty, period, done. Others are willing to breed her again if she demonstrates good mothering ability. You really want her to raise her own calf, regardless of how hard the first few days were. But again, you can use her calf outcome and her mothering attitude to decide if it's worthwhile to breed her back for another try. Now, an analysis of the 97 Beast survey that was completed just 2 years ago demonstrated that dystocia increased the odds for calf sickness during the first 6 weeks of that calf's life. In this study, heifers' dystocia rate was 4 times that of mature cows. Calves experiencing dystocia were more likely to get sick early on in life, and that reduced their weaning weight later. Heifer dystocia heifer dystocia led to exhausted heifers who don't encourage calves, and then weak calves who don't stand and nurse. And both of those things sets them up for failure of passive transfer. Now, the researchers in this study also found that calves unable to maintain their own body temperature had increased odds for sickness during their first 6 weeks of life. The bovine placenta does not allow the transfer of immunity, those large immunoglobulins, to cross from mom's circulation across the placenta to the fetus. Instead, all of the maternal transfer occurs during colostrogenesis, and it's stored in the udder to be consumed by the newborn. So passive transfer of immunity is available to the calf for its first 24 hours of life. It's immediately ready, its gut will absorb that immunity, but within 6 hours of birth, the gut's capacity to do that is cut in half. It's already by 50%. Nature cannot leave that gut open too much longer because small viral particles and bacteria will pass as well. And it's actually oral stimulation that starts the gut closure. Whatever ends up in the calf's mouth first turns that intestine on and says, hey, let's absorb whatever's coming our way. So that could be mud and manure and the bacteria from that, because the calf nosedived into a dirty pen. Calves sick or dying at less than 10 days of age is the hallmark symptom for failure of passive transfer of immunity. The average interval from birth to first standing varies from 30 minutes to 2 hours. Suckling time for calves born without assistance generally ranges from 1 to 4 hours. Standing time is correlated to the bull's genetics, being born to a twin, or being born a bull, or being born to a first calf heifer. Assisted calves, those whose presentation was corrected and/or were pulled, they're going to take twice as long to stand as an unassisted one. Now, on the flip side, the mom's side, colostrum quantity and quality decreases every hour that calf does not nurse. Failure of passive transfer of immunity sets that calf up for early illness early on, and that leads to increased illness later in life when she's growing up to be a replacement heifer, or they're showing up at the feedlot. Another impact from failure of passive transfer is from its long-term effects on the growth of the intestine and the intestine's ability to utilize feed. Maturation of calf intestine is enhanced due to colostrum intake. And without that colostrum, that intestine never reaches its full potential. The calf never reaches its ability to have a really good average daily gain, and that in turn leads to some decreased carcass grades. The picture is a serum refractometer. This is something that your vet can use. You can actually pull blood on calves that are 2 to 7 days of age and determine if they had gotten enough immunoglobulin from their mother at birth. Beef calves can suckle up to 4% of their birth weight at birth. And by 12 hours, they've been measured. They're known to have actually drank a total weight of 8% of their body weight in colostrum. And for those of you who don't remember, 1 gallon of milk weighs 8 pounds. If a calf is unable or unwilling to suckle, hand milk that heifer and immediately bottle feed the calf. And if the exhausted calf won't suckle, then tube feed it. And think about tubing 5% within the first hour of birth, especially if you knew it was a horrible calf. And then come back within 6 or 8 hours and tube it again, or offer a bottle again. Watch it to see if it has gotten up. Maybe it's drinking. By the end of 24 hours, you want it to have drank about 8% of its body weight. And if it's really a tough calving, I would push that to 10%. The second feeding of colostrum, or the second nursing, has a much lower rate of absorption than the first feeding. So it's critical to get enough in right away, the first feeding. There is an increased risk of failure of passive transfer of immunity when that colostrum is fed in 2 time periods. And this is why most in the dairy world have gone to just giving that calf a huge meal right away with the first feeding. Immunity transfer from colostrum is slightly improved when calves are fed it in a bottle, because that suckling reflex helps the body to put the milk right into their abomasum where it needs to, where it's best absorbed. However, if time is critical, it won't suckle, you are running out of patience, then go ahead and tube feed it. And then tube feed a higher amount. Go for 3 quarts, because you're not going to have that suckle reflex anymore. So you're going to end up putting some of that colostrum in that rudimentary abomasum and reticulum area, and we need to have the extra volume to spill over into the abomasum. Yonis and other agents are spread by a colostrum, so consider the source if you're going down to a dairy to try to get some of their colostrum. And cleanliness matters. Do not feed a manure meal. You have this on your slides. You can read through how to properly clean and store colostrum. Vaccines can be used to increase maternal immunity that passes into colostrum. And pre-calving vaccination is primarily done against those agents that cause scours in calves. Colostrogenesis, I used that big word earlier, that's the process during which maternal immunity is transferred into mammary cells. This happens during the 3rd trimester when the mammary cells are preparing for lactation. The process of moving immunity from mom's circulation into her mammary cells peaks at 5 weeks. It decreases from 3 to 4 weeks before calving, and it's completely done at calving. So right before calving, as you notice her bagging up, she's adding milk volume, not immunoglobulin at this time. Every minute past calving, the udder tissue makes milk. And those secretions don't contain immunoglobulin anymore. As labor begins, also there's that switch to lactation. She secretes more milk. She actually starts to dilute out the immunoglobulin that's in her udder. All the immunoglobulin that was put there ended up there 4 or 5 weeks before that calving. So we want to vaccinate to first stimulate her immune system to make immunoglobulin. And when it comes to a heifer, this is probably the first time they've seen these vaccines. So that first shot's going to have to be booster, with a second shot then that occurs before colostrogenesis is complete. And that's why this timing becomes more critical. You start the rotation with your shots 12 weeks before her due date, booster 2 to 4 weeks later, so now you're 8 weeks before her due date, which is 3 weeks prior to the end of colostrogenesis. As discussed in the earlier presentation, Will's pre-breeding vaccination program provides some fetal protection to the calf from the respiratory agents that also cause abortion, stillbirth, and calving abnormalities. This immunoglobulin is transferred into the colostrum during her 3rd trimester, especially if you use modified live vaccines pre-breeding. because those titers are high enough that immunoglobulin is still going to be present during colostrogenesis. Now, if you're pre-calving, a pre-breeding respiratory vaccine protocol used chemically altered or killed vaccines, then talk to your vet. You might need to be putting in a booster during colostrogenesis to try to get some immunoglobulin there. But develop your vaccine protocol with your vet, and remember, vaccinations are only helpful when the calf consumes the colostrum in a timely manner. So colostrum is that first milk that the calf drinks at birth. It contains immunoglobulins 1, 2, M, and A, growth hormone, estradiol, insulin, fat, protein, lactoferrin, and white blood cells. These good things, that insulin alone is what's triggering the intestine to grow and mature. British researchers are recommending that 24 grams per liter of serum immunoglobulin is the threshold to provide the greatest health and growth outcome for that calf. And in their research, 37% of the calves failed to achieve it. Beef heifers' concentration of immunoglobulin in colostrum is not statistically different than the mature cows. It's not tied, her body condition score is not tied to the immunoglobulin concentration in the colostrum. If her nutritional needs for energy and protein are being met, her body will move immunoglobulin into colostrum. However, the calf's total consumption is a factor of the immunoglobulin concentration per droplet times the number of droplets it drinks. And heifers have a tendency to make a less total volume. And the volume they make is tied to body condition score. Immunoglobulin concentration in the second milking is substantially lower, but it continues to have those hormones and those growth factors and those cell mediating factors that stimulate that gut to grow. Now, there's numerous products available on the market to replace colostrum or supplement colostrum. Read the label, there's a difference. The replacers have more immunoglobulin content in them. A good one will provide 100 to 150 grams per dose. And that is supposed to give a 10 gram per liter level of immunoglobulin. And I just told you they need 24. So maybe you need to feed 2 bags of replacer, and that's expensive. Or you feed 1 bag of replacer and some colostrum. Older studies talked about feeding 1 bag of replacer and 1 bag of supplement, plus some colostrum. The trick is have enough on hand so you can deal with those difficult calvings. As you buy these replacer products, look for the ones that are made from dried colostrum, not necessarily the serum-based products. There are serum-based products out there, but they're not going to have all that fat and those other goodies beyond the immunoglobulin. There's also available some high-energy gels or pastes. You'll see those, they're little tubes, and they don't have any colostrum in them. They're kind of like the idea with the caffeine. It's just a high energy boost to help a calf that's maybe wet or shivering, or is having a hard time. You want to have enough pens available after calving for the heifers that need that additional calf bonding time. You want to continue to feed your heifers separately from the adult herd until the adult herd is done calving, because doing so not only helps reduce pathogen exposure from the older cattle and now their younger calves who are going through the highest period of time for getting sick. Whatever they're doing, you don't want them giving it to your heifers' calves. And it also allows the fresh heifer less feed competition from the older animals. So you can offer supplementation if you need to, just to the heifers to maintain a body condition score of 6 postpartum and then into her early lactation. Eventually, you're going to put the whole herd back together. And that usually happens during shoot work when you start with those adult herd pre-breeding vaccinations. Utilize that early pregnancy diagnostics again to make sure that that first calf heifer conceives, because as we stated at the beginning, the second part of its success is that she's going to breed back and deliver a calf for you year after year. So that was my last slide. Anybody got any questions in the room? Oh, Tim's got his hand up.
Can you go through the proper process, I guess, that from the tube down calf growth?
The proper process for passing the tube when you're going to tube feed a calf. So if you're in tube feed or bottom feed a calf, everybody faces the same way. Okay. So straddle the calf. And you would be preferred if it was standing, but if it's not standing, it's got to be sternal. So get it up on its chest. You can't be doing this with the calf laying flat. Okay. And when you're passing a tube, it's probably better if it's standing. But everybody faces the same way. This is key because we got to know our left from our right. Back the calf in a corner and straddle it, because the strongest part of me is my legs. I can really make a calf behave better because now I'm bending over. If you're bottle feeding, you can put your hand under its chin, stick the bottle in its mouth, try to get it sucked. If you're tube feeding, you're going to pass the tube on the left side of the calf's mouth. So you're all facing the same way. That's your left side too. You stick to the left because that starts to go into their esophagus. If the calf really gets irritated by that, it's really kicking and not liking it, then you're probably trying to push it in its windpipe. So back up, slow down, pass it again. Talk to your vet about it. When you buy a tube, you can mark and figure out how much you got to put down. Put it down slow. He'll try to swallow it. When it's in, you can actually feel, you should be able to feel the windpipe and a tube, two separate things.